Hi, everyone. Thank you for watching this School Health Services program, an overview of using school-based Medicaid reimbursement dollars to improve student health. My name is Olga Genshin. I am the School Health Services Program Administrator for the Department of Healthcare Policy and Financing. We are the state's Medicaid agency. And a little bit later, you'll hear from Andrea Thornhill from the Colorado Department of Education. First, from the Colorado Department of Healthcare Policy and Financing, you will hear us refer to as HCPF throughout the presentation. And again, we are the state's Medicaid agency. So we are in charge of the side of the School Health Services program where school districts receive that reimbursement, that Medicaid reimbursement dollars through the School Health Services program. Here's just a high-level overview of the School Health Services program. If you start in the upper left-hand corner there in sort of that gold box, you can see that any public school district or Board of Cooperative Educational Services, or BOCES, with students in kindergarten through 12th grade may participate. And those school districts and BOCES that participate can get Medicaid reimbursement for health services that they're already providing. So these are services that they already have to pay for. They already provide to students that are enrolled at their school district or BOCES. This is just a way for them to get reimbursed for health services already being provided. So really, if the school districts and BOCES don't participate in this program, they're already doing the services, might as well get reimbursed for those Medicaid students, and they're really leaving money on the table if they don't participate in this program. This is a jointly administered program with the Colorado Department of Education, CDE. So we're on the HCPF side of the program. We are in charge of everything related to how those school districts and BOCES receive those Medicaid reimbursement dollars. On the CDE side of the program, they are in charge of everything related to the spending side of the program. And then those reimbursement dollars go back to the school district or BOCES to be used on health needs. And Andrea will talk a lot more about that when she presents in a little bit. Here's just a high-level organizational chart that you can see how all the different organizations work together to really make the School Health Services program happen. So to start there at the top with those federal agencies, that is where the program gets guidance, because these are federal matching dollars, federal reimbursement dollars that are received through the School Health Services program. So we receive guidance at the top, starting at that federal level with those federal agencies, and at the U.S. Department of Education and the Centers for Medicare and Medicaid Services. Those two agencies talk to each other when they need to, when things overlap, for example, for this program for school health services. And then those federal laws and guidance sort of trickle down to their respective state agencies. So U.S. Department of Education, those national laws and guidance trickle down to the Colorado Department of Education. And then for Centers for Medicare and Medicaid Services, for CMS, those national laws and guidance trickle down to HCPF, where I work, the state's Medicaid agency. Then again, the program is jointly administered at the state level between CDE and HCPF. Both of those state agencies support districts and BOCES that participate in the program. And Public Consulting Group is state's vendor that contracts with HCPF for administration of the School Health Services program. Districts and BOCES that participate can contract with a billing agent of their choice. They do not have to contract with a billing agent, but we do recommend it. It is just more cost efficient to contract with one of those billing agents. And then that billing agent sends billing data back to HCPF. And those fee-for-service claims are reimbursed at zero because school districts receive their reimbursement through a cost-based methodology. But the fee-for-service claims are required by CMS as proof of service that those services are happening in the school district or BOCES. Here's some more detail about Medicaid in schools and how those federal laws and guidance kind of all work together to provide those services in the school setting. So again, at the federal level, we have the Centers for Medicare and Medicaid Services that offer guidance that Individuals with Disabilities Education Act requires districts to provide students with disabilities with a free and appropriate public education, or FAPE. And the Medicaid agencies are responsible to pay for direct services in the student's medical plan of care, and the administrative costs and the support of the Medicaid state plan. At the state level, again, it is jointly administered between HCPF and CDE. The state Medicaid agency, that's HCPF, we administer that claiming program, and we work under those federal laws and guidance. HCPF reimburses that to the school districts and BOCES, and we have PCG as a vendor to support the program and support those school districts and BOCES. Districts and BOCES have to sign an intergovernmental contract with the state Medicaid agency. And again, those funds are recovered for services rendered to Medicaid enrolled students. Just a little bit more about those program roles and responsibilities. HCPF, we are the program policy experts. We administer training in the form of annual training, mid-year training, all of those trainings throughout the year, and just program support. We approve and deny random moment time study requests and cost reporting extension requests. PCG, Public Consulting Group, is again our vendor for the School Health Services program. They administer the claiming system, which is where all of the random moment time study is administered, all of the cost reporting, and they're the subject matter experts on all of those aspects of the program. And again, they administer that help desk through the PCG claiming system. CDE works with HCPF to provide training. They are the experts on the spending side of the program, so reimbursement spending. They collect those reimbursement spending reports, and they assist with that local services plan. Again, you'll hear from Andrea a little bit later, a lot more detail about exactly what those plans entail and what those reports entail. Districts and BOCES contract with HCPF, and they are responsible for fulfilling all of those responsibilities in the program for CDE, for HCPF, and for PCG. And they manage all of that reporting data in the claiming system and to CDE in order to participate. Here are all of the services that can be reimbursed through the program: mental and behavioral health, speech and hearing, physical therapy, occupational therapy, nursing, personal care, and physician services. The only thing that is optional on this slide is specialized transportation. So all of these services have to be listed in an individualized education program, or IEP, or another medical plan of care. So as long as these services are listed in a student's IEP or other medical plan of care, then they can be reimbursed through the program. The specialized transportation part of the program is one of the more complicated parts of the program. It can be kind of an overwhelming thing to learn the program, and specialized transportation is just a little bit more complex. So that is the one part of the program that is optional to get reimbursed for specialized transportation services. But it is a way that school districts and BOCES that participate can further increase their reimbursement through the program by participating in that specialized transportation reimbursement. Program overview: these are the requirements to participate. Again, you have to have that contract, that intergovernmental agreement with HCPF, enroll as a Health First Colorado provider, submit those fee-for-service claims. Again, like I mentioned before, that was through the billing agent that districts and BOCES can contract with to submit those claims. Participate in the random moment time study. That is just a 1-minute survey for all of the Medicaid qualified providers that are listed on district and BOCES staff pool list that just ask, what were you doing out of that 1 minute out of your day? It's completely random. And the participant then can say what they were doing, and those random moment time study moments, the percentage of those reimbursable activities are applied to this cost-based reimbursement methodology. So basically just trying to figure out, throughout the day, with all of the participants on the staff pool list statewide, how many of those participants were doing reimbursable activities at the time of their moment. Again, it's then assigned a percentage based on how many say that they were doing reimbursable activities. And then that percentage is one of the ratios that is applied to that cost-based reimbursement for participating school districts and BOCES. School districts and BOCES have to manage and update data frequently in the PCG claiming system. Again, they have to monitor that staff pool list, add those Medicaid qualified providers, and make sure that they are updating all the cost reporting that's required. And they have to have that local services plan approved by CDE. IEPs and other medical plans of care. So these are, like I mentioned before, the services to be reimbursed through the school health services program have to be listed in an IEP or other medical plan of care. They can also be listed in an individualized family service plan, those IFSPs. But those other medical plans of care can include healthcare plans, a standalone healthcare plan. They have to be separate from the IEP. If they're attached to an IEP, then they are part of an IEP. So I'm really talking about those standalone medical plans of care. And that can include, again, a healthcare plan, behavior plan, safety plan, maybe a 504. But really, they can have any name. They just have to meet the requirements that are listed here. And that includes having established medical necessity by a qualified medical professional. They have to include scope, duration, and frequency. So what service is needed, how often, how much. And then again, that provider has to log that service upon delivery. Those again are those services that billing agent is sending back to HCPF. So as long as those medical plans of care, including the IEP or the other medical plan of care, a standalone plan of care like a healthcare plan, as long as they include all of these components, then they can be reimbursed through the program. Here's the statewide annual reimbursement. You can see we have been on an upward path for several years now. And you can see there in the center, that was, of course, the COVID year, which hit everyone hard. That was also the year that we expanded. So before October 1 of 2020, we only reimbursed for IEP related services. On October 1, 2020, we expanded to include those other those standalone plans of care. And that did help offset some of the decrease that happened during COVID and when those in-person health services really decreased because students just weren't in school at that time for a while. So that is why we have that dip there, but expansion to free care services did help offset that decrease a little bit. And of course, that free care, then it was only 9 months out of that fiscal year. So we have been increasing since then, and we continue to increase. This slide is for those direct services. All of those services that are listed on those IEPs or those other medical plans of care. And this slide is for the quarterly reimbursement for those outreach and enrollment program administration activities. So they're quarterly. That's why you see 4 different boxes that are listed there in each year, and those are increasing as well. So if you have an outreach and enrollment department, or if you have staff that are at your school district and BOCES that outreach to families to try to enroll them in Medicaid or get them other services like food stamps, TAMF, something like that. Those are those activities that can be reimbursed through these quarterly reimbursement, among other activities. Here is a map for the current school health services participation in Medicaid enrollment rates. So you can see, again, we support over 88% of the student population in the state of Colorado. And that includes all of that sort of bluish gray section that is listed on this map. Of course, that includes all of those major metro areas, and that's why we have over 88% of the student population supported by the program. That sort of pinkish red area, those are the school districts that don't currently participate. And again, that's why we are talking in this DU Rural Summit today, is to hopefully bring more of those rural school districts on board. The circles there are the Medicaid enrollment rate for the county. So that includes the population under 21 in the county. We don't have for those counties that don't currently participate, for those school districts and BOCES that don't currently participate, we don't have the Medicaid enrollment rate by school district or BOCES, but if they decided to participate, we would calculate it on a school district or BOCES basis after that contract is signed. And that is also one of those ratios that is applied to that cost-based reimbursement methodology. So really, the higher that Medicaid enrollment rate for the school district or BOCES, the more bang for your buck you get for that school district or BOCES Medicaid reimbursement. So those higher levels, really that circle gets larger and greener, then the higher the Medicaid enrollment rate in the county. Again, we would calculate that on a school district or BOCES level if the district or BOCES decides to participate, but you can at least see what those Medicaid enrollment rates are like in the counties with school districts that don't currently participate. And this is just zoomed in. You can see the school-based health clinics, which is a separate thing from the school health services program, but you can see where those are located throughout the state. And now I will toss it over to Andrea Thornhill, and she will give you some updates from the Colorado Department of Education.
Hello, my name's Andrea Thornhill, and I'm the Medicaid consultant for the Colorado Department of Education. I'm here today to share the Colorado Department of Education's portion of the Medicaid School Health Services program. Our primary purpose is to provide support and guidance to participating school districts with the spending of their Medicaid reimbursement dollars. Two main Colorado Department of Education program components include assistance and guidance with local service plans and the collecting and reviewing of reimbursement spending reports for program compliance. What is a local service plan? A local service plan is a document school districts create outlining in detail how Medicaid reimbursement dollars will be spent. This plan lasts for 5 years, but may be revised in between if needed. The plan must include community input from a health and wellness committee and identify and prioritize the health needs of students. The plan will then in detail go into what money will be spent on satisfying these identified health needs. These plans take some time to put together because of the required community input, but again, they're only required to be renewed every 5 years. We offer a lot of support for this process through our CDE School Health Services webpage and through trainings. Documents on the webpage include a local service plan template, development strategies, and a health needs assessment you can share with your community. We also require participating districts and BOCES to complete a reimbursement spending report. This is an annual report due to the CDE informing how Medicaid reimbursement dollars were spent in any given fiscal year. It includes detailed information about how much money was spent on administrative and health service expenditures. Let's get into more of detail of how districts can spend their reimbursement dollars. What is an allowable expenditure? There are two main rules. It must be spent on student health services, and the expenditures must align with the local service plan for that school district or BOCES. Some other considerations about expenditure allowability. It's flexible. It can be spent on one, many, or all students. For example, specialized equipment for one student, OTs or PTs that serve many students, or nursing supplies that serves all students. Ultimately, it does need to be used to enhance, expand, or support health needs for students. Scan the QR code here to see specific examples for allowable expenditures. A great benefit of this program is there really is a broad range of ways the reimbursement dollars can be spent. A portion can go towards the School Health Services Program Administration. For example, paying for a Medicaid coordinator for your district or a billing agent. Keep in mind, we do recommend keeping administrative expenditures below 20%, as the main goal is to support the health needs of students. For health services, we have 6 main categories to choose from: nursing services, mental health services, special service providers, student health programming, outreach to the uninsured, and health-related transportation needs. This can include paying for staffing for any of these categories, but may also include the following subcategories, such as materials and equipment, screenings, emergency assistance funds, health-related professional development, and any other health-related services. Another great benefit is you can use the reimbursement dollars to further increase your reimbursement. For example, if reimbursement was spent to fund more district nurses, you could then claim those costs for nurses to increase your reimbursement. We do have some rules how the money can't be spent. The two main areas include if the expenditure does not satisfy a health need, if it does not align with a local service plan. Here are some examples of non-allowable expenditures: general transportation, general education, for example, math or reading curriculum, student monetary incentives for trainings or events, or any other equipment or supplies for non-school health services program FTEs. From the reimbursement spending report we collect, we're able to see how all the participating school districts and BOCES spent their Medicaid reimbursement dollars. Here is the overall statewide spending for fiscal year 22-23. Over $64 million were spent, including $58 million spent on health services benefiting students. The reimbursement dollars also contributed to hiring 899 full-time employees. Here's a breakdown of how the reimbursement dollars were spent on each of the main health service categories for fiscal year 22-23. Nursing services took the lead with over $27 million spent and 474 full-time nursing staff. Does your district or BOCES participate? Right now, we have 5 BOCES, 1 state-funded organization, and 56 school districts. The full list of participation can be found on the Colorado Department of Education School Services website. Make sure your district or BOCES is not missing out on reimbursement dollars that could support the health needs of students.
Thank you, Andrea. Now I'd like to go over some of the program support that is available to participating school districts and BOCES in the School Health Services program. As you can see on this page, we have a lot of support for newly participating districts and coordinators. In sort of that dark blue shade, Those are all of the supports that are available to all school districts and BOCES that participate on an ongoing basis. We have monthly office hours, recorded webinars, and the program manual. We have vendor help desk support in the form of PCGs, claiming system help desk, stakeholder support, and of course, state agency support from both CDE and HCPF. Once a year throughout the program, we have annual training. That's a full day training that takes place in August. And then we have mid-year training that takes place in usually late January or early February. Those are also both available to all school districts and BOCES that participate. For newly participating school districts and BOCES or new coordinators, we have monthly mentorship meetings. You can see there in the center in that green circle. And we also have a one-time in-depth new coordinator training that takes place in September. And that is about a half-day program training as well. If you know a school district or BOCES that is interested in participating, here are the steps for participation. By November 2025, we would recommend that you request a mock cost report that would give you an idea of a very conservative estimate of what your school district or BOCES could receive as far as Medicaid reimbursement through the program. And then shortly after that, we would recommend that you enroll as a Health First Colorado provider. That is a requirement of the program, but it can take several weeks to up to a few months to get that approved, just depending on what information lines up and what additional information is required. But that can be a lengthy process. So we do encourage interested school districts and BOCES to complete that as soon as possible after you've decided to move forward with participation. Then in early spring of 2026, we would ask that you get that contract signed. We would have a start date of July 1 of 2026. And that means that you could start participation on October 1, 2026. What happens is all of the school districts and BOCES that participate in the program start building their staff pool lists on on August 1. And that means that all school districts and BOCES start their random moment time study on October 1. So we have that staff pool list start date of building that staff pool list on August 1. And then you can start that random moment time study participation on October 1. And that local services plan that Andrea talked about earlier would need to be submitted by July 1st of 2027 to get that draft submitted. Here are some frequently asked questions regarding the School Health Services Program. First, can a private duty nurse bill for Medicaid for services provided in a school setting? They could. So this means that they would be billing outside of the School Health Services Program on a fee-for-service basis. But really, that applies to any provider in the school district. It could be a provider other than a private duty nurse, but really that authorization starts with the school district or BOCES. They all have their own set of background checks and other policies that differ from district to district, from BOCES to BOCES, that kind of thing. So they have to receive permission from the school district or BOCES where they want to provide those services. There are a lot of things that go into that requirement. So there's a link there where it says this letter to read a lot more about how that would happen to be able to bill fee for service, again, outside of the School Health Services Program within the school setting. The next question is, are telehealth services billable through the School Health Services Program? Yes, they are. They are a valuable method of delivery for rural school districts, so very applicable to the audience that we're talking about right now. Of course, it is hard to hire some of those providers in a very small or rural school district. So being able to provide those telehealth services are very valuable in those rural school districts. Next question is, do all school districts participate in the program? They do not. That's one of the reasons we are presenting this right now at the DU Rural Summit. We do support over 88% of the student population in the state of Colorado. As you can imagine, that remaining 12% really are those rural school districts and BOCES that don't currently participate. Again, that's why we're here right now. So we have those larger school districts covered. We have a lot of the small school districts covered as well. But if you know school districts and BOCES that want to participate, please email us. The email address is right there, and you can look at the School Health Services Program website that's also linked there for more information. Can a private school participate in the School Health Services Program? They cannot. That's part of those federal matching dollars that we receive. Only public schools may participate. And again, that is a requirement to receive those federal matching dollars for the program. Can charter schools participate in the program? Charter schools are public schools, and they can participate with their public school contract or through the Charter School Institute. Currently, the Charter School Institute does not participate, but we do have many public schools that have charter schools. So, of course, those charter schools participate as a part of that public school contract. Can participating school districts be reimbursed for outreach and enrollment activities? Yes, and they already are as part of the School Health Services Program. This is part of that quarterly Medicaid administrative claiming cost reporting to get reimbursed for those activities. Here are some more resources for you. We have the Department of Healthcare Policy and Financing website, that HCPF website, listed there at the top. Again, lots of resources for anyone interested in participating or just learning more about the School Health Services Program. That very robust program manual, newsletter, training, stakeholder forum information. We have recorded webinars that you're welcome to watch on the training website. And we have the Colorado Department of Education website as well. That's where Andrea works, including local services plan information and that reimbursement spending report to CDE. And thank you very much. We have our email addresses listed there at the bottom if you have any additional questions for either Andrea or I. And we appreciate you watching today.